lecture, so we're onto the joints and kind of how the bones come together to kind of create some motion in the body. In this one, you have a lot of definitions, and we have a lot of different little categories that you want to make sure you're aware of, and make sure you can list everything under the proper kind of classifications, because again, those are really good multiple choice questions. Okay, so you want to really make sure you can take a piece of paper, list all the different things that we are kind of going to talk about in the chapter, and then again, just kind of make these little categories and put everything in that little distinctive category, so that when it pops up on the multiple choice, you'll be able to get those right. Okay, and we'll point those out a little bit as we go through the chapter here too. So the first thing we want to talk about is, again, when we're talking about joints, we're talking about where these bones come together and where they're going to meet. So the proper term for that is going to be articulation. So you'll hear people say articulation, you'll hear people say joints. You have two fundamental functions. They're going to give the skeleton mobility. So again, we're creating motion between bones, and they're also going to hold the skeleton together. One thing you want to again be aware of is that joints are going to be, because we're creating this motion, and we can't just have these kind of thick, complete bones, they're going to be the weakest part of the skeleton, okay? Because they're going to be these two bones coming together, and they're not going to be held together by bone. They're going to be really kind of held together by these other little structures that we'll see as we move through the chapter. So they do provide some protection, but their main job is to, again, provide mobility, but they're going to protect us from a little bit of the crushing and the tearing based on what the joint is composed of. And their main job is really to be able to kind of transfer this force to your muscles. Okay, so we're using our muscles. They're going to create force. They're going to pull on the bones, and then they're going to create motion where the bones come together, or at our joints or our articulations. So here's where we get to the tricky part. So we have a lot of different joint classifications. So we can classify joints based on their function or based on their structure. When we're talking about their functional classification, we're just basing this on the amount of movement that is allowed. So some joints are going to provide no motion, some joints are going to sort of provide a lot of motion, and again, we want to be able to make sure we sort of know what the difference is. So we have three types of functional classifications, and again, these are great multiple choice questions, because I can put, hey, which one of these is not a functional classification, and I can list all these and then throw in one of the structural classifications, or kind of vice versa. So you just want to make sure that you know when we're talking about functional classifications, it's based on the amount of movement that the joint is allowing, and there's three types, okay? So this is your first little subclassification. You have synarthroses, we have amphiarthroses, and then we have diarthroses, okay? And then when we're talking about structural classifications, this is based on the material that is binding the joints together. So one is based on motion, one is based on more material, and this one's also going to be determined by whether or not there is going to be a joint cavity, okay? And for this one, we get three more subtypes. We get a fibrous one, we get our cartilaginous one, and then we get a synovial one. And we start to, again, from our tissue chapter and from our, our microscope chapters and things like that, we start to get a little idea of, okay, this one's going to be made out of cartilage, this one's going to have more fibers. The synovial one might be the one that we're not quite as familiar with. So again, you make sure you know there's two different classifications, and then make sure you know what the three types of each classification are going to be, because again, these are really, really good, easy kind of multiple choice questions. So when we're talking about functional classification, again, we're talking about motion. We said we have a synarthrosis, we have an amphiarthrosis, and then we have a diarthrosis. Synarthrosis is immovable joints. Amphiarthrosis is slightly movable, and these ones are going to be found mostly in that exoskeleton. And then we have our diarthroses, and these are going to be found in our limbs, and these are the ones that are going to be freely movable. And when you talk about the exoskeleton, again, you're talking about the brain and the spinal cord, again, so we don't want a ton of motion, right? We want to be able to keep those structures really, 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 really safe. Okay, and then when we get to our limbs, freely movable, we want to create a lot of motion. We also want to come back to this little relationship here, which is where we talked about this in the last chapter 2, where we talked about mobility versus stability. And then we said, you can't really have both, okay? So if I have a ton of mobility, I kind of lose stability. And if I have a ton of stability, I'm going to lose some motion. And again, the more mobility I have in a joint, the more, more likely it is it's going to be damaged, or it's going to be a little more vulnerable. Now we get to our structural classifications, and again we had three: fibrous, cartilaginous, and synovial. And a fibrous joint, again, you can tell by the name, it's going to be connected by fibrous connective tissue, okay? No joint cavity. The amount of movement is going to be dependent on the length of the connective tissue fibers. Most of these, again, are going to be immovable. You get another three types of fibrous joints. So again, I'm putting everything into their nice little categories, and I want to make sure I can list everything. Three types of fibrous joints. I get sutures, I get syndesmoses, and I get gomphoses. And again, I used to always kind of put things like each letter, right? So fibrous joint, SSG, and then I could take that first letter and I could remember that it was suture, syndesmoses, gomphoses. But again, go back, make sure you know the classifications, and then when I'm sort of breaking it down into the types in the different classification, I want to make sure I can list all the different types of, again, fibrous joints, and then we'll move on to the next ones. So here is a suture, and again, most of us are maybe aware of this with the skull, but these are going to be the seams of the skull bone. They're going to be filled with fibers and continuous with the periosteum, or that outer layer of the bone. Okay, syndesmoses, they're going to be connected only by a ligament or a fibrous band. The movement, again, is going to be determined by the length of that fiber. Okay, so the longer it is, the greater the motion you're going to have. The shorter it is, the less motion you're going to have. Gomphoses are a peg in socket fibrous joint, and the best thing to do with this one is just to remember that this is going to be your tooth kind of fitting into a socket, but it's going to be connected by this periodontal ligament, which we'll see in a picture here in a second. So here are my sutures, and again, when you kind of they're just kind of cool because if you had a skull in front of you, you could feel all these little kind of sutures. But if you have any little kids in their family, or you've had little kids in your family, you can kind of put your hand on their skulls and you can feel all the different little plates, and you can feel how there's these little seams in there. Because when they're little, these bones are not fused so that that brain can grow. But once that brain is full size, we're going to fill up all these little kind of lines in here with fibers and kind of make the skull one sort of solid little structure. Okay, so these are my sutures. And again, I'm just filling up all these little lines with these fibers. Here's a picture of a syndesmosis. So again, we're using a ligament. Okay, so this is my fibula and my tibia. And again, I'm going to have this little ligament that kind of holds them together, but does not allow a ton of motion. And then here is my peg and socket. Okay, so another fibrous joint. But again, I'm using this little ligament here to sort of hold that tooth in the socket. So again, make sure you can list everything under those proper categories. So now we get to cartilaginous joints. So this one's kind of easy because again, the bones are going to be connected by cartilage. So the name kind of tells you what type of joint it's going to be. Again, no joint cavity. These are again going to be virtually immovable, or they're going to have very limited movement. But again, I get two subtypes. I get a synchondrosis. Anytime I see chondro, and we want to start to sort of remember all these terms that we've seen in the past chapters, but chondro is always going to mean cartilage, okay? And then we get this symphysis. And we've heard about like the pubic symphysis. You want to start being like, okay, I've heard that term before. Where did I hear it? And sort of go back to those pictures and kind of check them out. So synchondroses, these are going to be epiphyseal plates or costal cartilage. So what I'm using here is a plate of hyaline cartilage to unite the bones. And again, these are going to be virtually all immovable, okay? Symphyses are going to be a little bit different. These are going to be your intervertebral joints or your pubic symphysis. And for this one, I'm going to use fibrocartilage. So again, synchondrosis, I'm using hyaline cartilage, symphysis, fibrocartilage. And again, these are just good multiple choice questions where, okay, do I know what type of fibers or what things I'm using to sort of unite the bones? So synchondrosis, hyaline cartilage, symphysis, fibrocartilage, okay? And these are good because they're compressible, they're resilient, they're going to allow limited movement, and they're going to be designed for strength and flexibility. So here's my picture of my synchondrosis, and again, I'm using hyaline cartilage for this one, so I can see my epiphyseal plate where my bone is still growing, and I can see my costal cartilage. And then I get to my symphysis, and these ones are going to be, again, fibrocartilage, so my discs in between my vertebrae, and then we have that pubic symphysis, which is going to be kind of unite those pelvic bones sort of in the anterior part. Now we get to the synovial joints, and these are the ones that most of us think about when we think about joints in the body, but these are joints in which the articulating bones are separated by a fluid-filled cavity, okay? So it's a joint cavity filled up with fluid. These are the ones that are going to permit substantial movement, okay? So all synovial joints are going to be freely movable, includes nearly all joints of the limbs, and includes most joints of the body. So another good multiple choice question, okay, is that these are going to be the most common. They also have 6 distinguishing features, and if we were in class and we were doing written tests, this would be one of your written questions. So you would kind of list all 6 distinguishing features. You'd give me a brief explanation of sort of what they are. But in this one, again, it's another easy multiple choice question because they can be like, hey, which one of these is not a distinguishing feature of a synovial joint? So they're going to have articular cartilage, okay, so joint cartilage. They're going to have a joint cavity. They're going to have articular capsule, Okay, they're going to have synovial fluid, they're going to have reinforcing ligaments, and then I'm also going to have nerves and blood vessels. And again, we want to be able to kind of list all these, but we want to be able to kind of find them on the image and realize that these are all parts of the synovial joints. Okay, but this is what allows them to provide so much motion. So here's a picture of two bones coming together. And again, I can kind of find all these things, right? I can find these ligaments. I can find the joint capsule. And again, this one's going to be filled up with fluid. I can see the ends of the bones are covered in cartilage, okay? And I can find all those six distinguishing features kind of on these. And the one that's probably the most easiest to remember is going to be the knee, because most of us are kind of familiar with how the femur comes down and sits on top of that tibia. And for me, like when I was a kid, my grandfather, he used to always go to the doctor, and they would actually like put a big needle into his knee and sort of drain the fluid out of this capsule. And that's kind of one of the things that I remember most from kind of being a kid is just going to the doctor with him and kind of watching them stick this needle in there and then pull this fluid out of there when it got real swollen and kind of irritated. Okay, so a good picture to come back to, and to be able to make sure you can find all these distinguishing features. Okay, and then we'll look at them each a little more specifically here. So the number one was articular cartilage. So we want to remember that hyaline cartilage is going to cover the opposing bone surfaces, because remember, our bones are really sensitive. So we cover them up in cartilage so that they can slide over each other easier. It helps us to absorb stress, provides a little bit of cushioning, and then it's going to prevent those bones from crushing. And what it's also doing is sort of blocking our bones from, or the sensitive part from sort of being so sensitive when we sort of move and do things. And one of the biggest things that happens as we get older is we get arthritis. We lose this cartilage on the ends of the bones. We expose those sensitive bony surfaces, and then people start to get a lot of pain and discomfort. Okay, so really, really important to kind of keep that cartilage healthy. You also are going to have a joint cavity. So this is the space containing the synovial fluid, and we'll come back to a picture here in a second. We're also going to get an articular capsule or a joint capsule. So this is going to be the part that encloses the joint cavity. It's going to have a tough external fibrous layer, continuous with the bone, prevents the bones from being pulled apart. And then we're going to have this inner synovial membrane, and this is going to be the inner part of the joint surface. Okay, so lines the inner joint surface. And we come to the synovial fluid, and this is a really important slide, okay, because this is the fluid that's going to fill the joint capsule. It's going to provide a slippery, weight-bearing film, reduces friction between the cartilages, prevents the joint surface from deterioration. This is one of the important things here, though, okay? So the fluid is forced from the cartilages when the joint is compressed, or you can think about it as when I put weight on there or I load that joint up, I'm going to compress those surfaces, and I'm going to force that fluid out of the cartilage. Then once pressure is relieved, that fluid is going to seep back in like a sponge. So what happens is I load all that joint up, it compresses the cartilage, the fluid gets forced out of there, and then when I take that weight off, or I take those forces off that joint, I'm going to unload the cartilage, and all that fluid's going to kind of seep back into the cartilage. But this is how we get nutrients, okay, to those cartilage surfaces, because we want to remember that cartilage, it's avascular. So you can see down here it says, we're lubricating the free surfaces of cartilage and nourishing the cells. Okay, so cartilage is avascular, meaning it does not have its own blood supply. So the only way that it gets nutrients is by sort of unloading and unloading your joint and sort of putting your joints through their full range of motion. Okay, so really, really important to remember that you have to have this motion and this loading and this unloading. Otherwise, your cartilage does not get the nutrients that it needs, and then it starts to deteriorate. Okay, we're also going to, within this fluid, we're going to have these phagocytic cells, and they're going to just help us to keep everything healthy and sort of rid that cavity of any sort of debris or microbes. Now, one of the questions I get with my patients all the time is that they'll come in as they get older, and we know that a lot of older patients, they like to do the water aerobics. And they like the water aerobics because, it's easier on the joints and it's easier on the body. But the one thing it does, because it takes so much of your body weight off of those joints, it does not do a good job of that loading and that unloading. So this, for most people, they'll do the water aerobics, and then they'll wonder sort of why their arthritis keeps increasing, or why they start to get this increased deterioration of the joints. It's because this kind of eliminates that loading and that unloading. So you try to tell people that you cannot only do the water aerobics, okay? It can be part of your exercising to get stronger and get your range of motion back, but we have to do some loading and some unloading too, or just some weight-bearing exercises, so that we're making sure that we're getting those nutrients into that cartilage. The other most important thing to remember is that, and we'll come back to this with arthritis, is that if I'm only using, if you say, my knee joint has 130 degrees of motion, and I'm only really using, 45 or 60 degrees of that motion, only that part of the cartilage is getting any nutrients. Okay, so this is where if you have someone where they have a knee surgery, the most important thing you need to do is get all of that motion back so that we're using the full motion and we can use our full range of motion so that we're getting nutrients to all those surfaces and that they don't continue to deteriorate. Okay, so water aerobics is very good for strengthening, but again, you have to do some loading and unloading to keep those joint surfaces healthy. So number 5 was we have reinforcing ligaments. So synovial joints are reinforced and strengthened by band-like ligaments. Again, we know of this because we'll talk about all the ligaments in the knee, and a lot of us have kind of had knee injuries and kind of torn ligaments. But these are also going to usually come from that capsule, so you want to remember that the capsule and the ligaments are kind of a continuous unit, not something that's totally separate. And then number 6 was that we have nerves and blood vessels. We have a rich supply of nerves innervating the capsule. So we have pain ones, we have stretch ones, we have joint position. We're getting a lot of information kind of set up to our brain to kind of tell our brain what our body is doing at any particular time, and to sort of help us to prevent from further damaging structures if we're moving in improper ways. We also have a rich supply of blood vessels, and this is going to help to sort of supply us with that synovial fluid to keep those surfaces nice and healthy. But we all kind of know that these joints are sensitive, right? And we know that we can sprain them and move them in different directions, and they can be really, really painful and really, really sensitive. Okay, so here's a picture again where we just want to find all of those things, and then again at the end of this chapter, we're going to come back and look at specific joints in the body, and we'll look at the knee, and then again we'll come back and kind of find all these things. But we want to realize that we have a capsule, okay? We have our ligaments, we have our cavity, we have this fluid inside the cavity, and then we have our bones. And the end of those bones are going to be covered in this cartilage too. Okay, but we're creating this really awesome, very mobile joint. And again, this is going to be the most common one throughout the body. So other structural features that you'll hear about and you'll see, you're going to have fatty pads. They're going to provide cushioning, okay, between the fibrous layers and the synovial membrane. You're going to also have articular discs or meniscus, okay? A lot of us have kind of heard about like you tear your meniscus. Okay, but these are going to be wedges of fibrocartilage, and they're going to separate articular surfaces. And these ones are just an extra layer of protection, and they're going to help to improve our joint fit and stability. And again, we'll come back to these ones, and we'll kind of see these ones in the knee too. But their main job is just to, again, improve that fit, improve stability, and then just be an extra way to sort of decrease any sort of wear and tear. Okay, but the articular discs in between the vertebrae, and then we also have these the meniscuses in our knees, and we have some other fibrocartilage stuff kind of in the shoulders too that are again just used to kind of strengthen that joint a little bit. So we'll come back to those kind of at the end of the chapter. We're going to have bursa. A lot of us have heard of bursitis. So these are bags of lubricant closely associated with synovial joints, and their job is to reduce friction between adjacent structures during joint activity. And most time your bursa, what they're going to do is kind of keep those muscle tendons kind of off of the bone surface. But they can get inflamed because, again, the muscles get really, really irritated. You have this increase in muscle tension. They put a lot of stress on that tendon, and they'll kind of compress it against the bone, and then you can get a lot of inflammation and pain too. Okay, tendon sheath is basically just an elongated bursa, and it's going to wrap around a tendon. And again, its main job of all of these ones is to reduce friction between these structures. So here is a picture of our shoulder. This is my humerus. Okay, this is my scapula, right? And I have my glenoid cavity. So this is my AC joint or my acromion up at the top. And you can see where I have these bursas wrapping around these tendons that are coming up from my bicep muscle. And again, what they're doing is they're keeping this tendon from rubbing on this bone all the time. And also I have this other bursa that's going to keep these tendons here. So these are all my rotator cuff muscles and my biceps. But again, it's protecting them from those bony surfaces and making sure that they don't get damaged any more than we need them to be. Okay, and then here's just a close-up picture of, we can see as we get these unstable shoulders, and we talked about how the rotator cuff muscles are supposed to hold the humerus in the socket, and when they get fatigued or injured, they can't do that. This humerus starts to kind of creep up, and one of the things that'll happen is it'll kind of put a lot of pressure on this bursa, and you'll get a lot of pain and discomfort. Okay, so again, if those muscles can't do their job, this bone creeps up into the joint, and it'll push this or compress this bursa sort of on that acromion. And again, it can create a lot of sort of pain and impingements and discomfort. Okay, so factors influencing stability, another good multiple choice question. So joints are constantly subjected to stretching and compressive forces. They must be stabilized so that they do not dislocate or come out of alignment. It's going to depend chiefly on three factors. Okay, so factors influencing stability, chiefly three things. It's going to be the articular surfaces, okay, joint surfaces. It's going to be my ligaments, and it's going to be the muscle tone that are going to sort of influence how stable that joint is going to be. So articular surfaces play a minor role. Another good multiple choice question is which one of these is the most important? Articular surfaces or more the structure is going to play a minor role. And what they're talking about with the articular surfaces, this is the shape of the joint surface is going to determine what movements are possible. And we talked about with the shoulder versus the hip. Sometimes we have a very shallow joint that's going to be less stable but have more motion. Sometimes we'll have a deeper joint where it's going to be a little more stable. Okay, ligaments. The more ligaments you have, the more stable it's going to be. The shoulder is another great example of this, of where the shoulder has a very limited amount of ligaments. The hip has a ton of ligaments, so that hip joint is going to be way more stable. Okay, so ligaments are going to prevent excessive undesirable motion. What you really want is that your muscles, are going to kind of limit the motion. When you get to the point where your ligaments are stopping you from moving into ranges that you don't want to be sort of moving into, this is where you're already doing some damage. Okay, so this is where the muscles haven't protected you. I get that joint a little too far into one motion versus the other, and I start to sort of strain these ligaments, and then they're going to also obviously get injured, or they're going to start to tear a little bit. So they can stretch approximately 6% before they're going to snap. Okay, the third one, and again, one of the most important ones to understand, is that muscle tone is going to give you a lot of stability. Okay, so usually the most important one, your tendons are kept under tension by your muscles. Okay, and then that tension is going to sort of provide this stability to the joint. So tone is low levels of activity, and this is going to sort of increase this reaction readiness. Okay, and what you want to think about with your muscles is you want to think about, if I keep my muscles really, really strong, okay, they're going to take a lot of stress off of my joints, okay? But the one thing that happens with muscles is if they're not strong enough, or they fatigue, or they get injured, we lose this part, okay? So when you come back to this factors influencing stability, and you have your three chief factors, if those muscles are injured, they're fatigued, they're not working properly, right, they're not able to perform their function properly, we lose that most important factor in producing this joint stability, and then the joints are allowed to get into bad positions. I start to load up my ligaments, I start to load up the joint surfaces, and then I just end up doing a lot of damage. Okay, so this is one of those things that we're kind of in control of this one, and we can do exercises and we can do certain things to kind of make sure that those muscles are protecting our joints as much as possible. And obviously with certain sports, you're going to be more prone to certain injuries. So if you have a kid that plays baseball, or they play tennis, or they play volleyball, or they swim, that their shoulders are going to kind of take a beating. So it's one of those things where you want to be very proactive, and you want to say, hey, I know their shoulders are going to absorb a lot of stress. We're going to make sure that those shoulder muscles are strong enough, and that we're training them properly enough to sort of provide that stability to that joint. Okay, in every sport, every job, a lot of you are kind of going into nursing, right? So a lot of you, you want to be like, okay, if I'm a nurse, what parts of my body are the most vulnerable? The shoulders are going to be one of them. The low back is going to be one of those. So you want to try to really sort of keep those parts really strong, and let your muscles absorb as much of that stress as possible, because that's what they're made for, is to keep that stress off of the joints, because once you get that joint deterioration, there's kind of no going back. Okay, so keeping those muscles strong is really the best way to sort of keep your body in the best shape possible. Okay, that's the end of part 1 for chapter 8, and then we'll come back, we'll look at some terminology in part 2, and then we'll finish up with some specific joints in the body.